Hello everybody, my name is Dr. Sharath Krishnaswamy and I am a neuroanesthesiologist. Today I shall talk to you about what hyperthyroidism and hypothyroidism can do to your body under surgery and under anesthesia. So how do we first recognize if a patient has hypothyroidism? Let's say if a person has brittle nails, dry skin, gaining weight rapidly and unable to do their normal activities because they feel tired very frequently, then this is a condition where you have to investigate, and then you might find out that the patient has hypothyroidism. Whereas on the other hand, if you look at a patient who is unable to sleep, who's always fidgety, who's nervous, who has lost weight and who cannot stand very hot temperatures, then in that case the patient might have hyperthyroidism. So these two conditions you can diagnose by doing a few tests, which are hormonal tests basically. The three tests that are important are the TSH, the T3 and the T4. So the TSH stands for the thyroid stimulating hormone, the T3 stands for something known as a triiodothyronin, and T4 stands for tetraiodothyronin. So now the TSH, which is known as a thyroid stimulating hormone, is secreted by the pituitary, that is right in between your eyes and deep inside your brain. So the TSH is first secreted. That goes down to your thyroid gland where the thyroid hormones are being secreted. So these two thyroid hormones are the T3 and T4, which help in the metabolism of the body, in production of heat, modulating your sleep-wake cycle, and a lot of other activities that thyroid takes care of. So now it is important that when a patient comes to surgery, that these thyroid hormones are within the normal limits, because there are few side effects or complications that can happen in case the patient has hypothyroidism or hyperthyroidism. So let's say if a patient has hypothyroidism, then there's a problem that the patient may take a longer time to wake up after surgery. This is because the thyroid hormones help in the metabolism of the body as well as the metabolism of the anesthesia drugs that we give. And in case the anesthesia drugs do not metabolize and are excreted from the body, they tend to circulate more and the patient tends to be under anesthesia for a longer time. Now, if you can compare this to hyperthyroidism, that is when there is increased secretion of those thyroid hormones, and this causes the increased metabolism in the body, increased metabolic rate, as well as the increased metabolism of the anesthesia drugs that we give. So let's say we give the drugs, they get metabolized quicker, and we have to give more amount of anesthesia drugs to cause the same effect on the body. So how do we get out of this situation? So it is important that before a patient comes for surgery, the patient will have to be clinically, and the lab investigations of thyroid hormones will have to be within normal limits, which means the patient should not have the symptoms of hypo or hyperthyroidism, like I mentioned before, as well as the normal levels of the hormone should be maintained in order for the patient to be cleared for surgery. So let's say we suspect somebody to have hypothyroidism, or the patient already has hypothyroidism. Then what we would do is we would ask for the hormonal assay of the thyroid hormones, which is the T3, T4 and TSH. And in case they are not within normal limits, we recognize that the patient has hypo or hyperthyroidism. What we do then is we consult the endocrinologist, who will give the respective tablets, medication to the patient who has hypothyroidism, which is most probably Thyronorm or L-Troxin. And once the patient has been started on these tablets, these have to be continued on the consultation with the endocrinologist for a period of at least 6 weeks to 3 months. So that is when you can actually see that the patient has been responding to the medication. We do a repeat test of the T3, T4 and TSH, and once they are normal, only then the patient can be fit for surgery. So once the levels are within normal limits, then the patient may not have the complications of hyper or hypothyroidism, and the patient can recover better from surgery. Thank you.